Now with Dr. Darien, and for the first time in decades, the FDA has approved a non-opioid painkiller to treat pain in adults.
And it's for acute pain too. It's something that I can use in the emergency room. Hopefully it'll be more available. So the medication is called sutradine, and the way to understand how this medication works, we first have to understand how pain works. So let's say you stub your toe or jam your finger. That signal is traveling by nerves, enters your spine, goes to your brain, tells you that you have pain so that you can react to that pain stimulus. Now the way that opiate medications work is that medication, once you take it, releases dopamine in your brain, creates this feeling of euphoria, and kind of distracts you from that pain. Now, the problem is that dopamine overlaps with other reward pathways, and that is one of the reasons why opiate medications increase the risk of addiction. Now, this new medication works in a little bit of a different way. The way that it works is it is a sodium channel blocker, and what that means is that it blocks the signal of pain from going from that stub finger, that stub toe, to traveling to your brain, and it doesn't involve that dopamine access, and therefore decreases the risk of you being addicted. And in these studies, it found that when taken, it had almost similar benefits to people taking opiate medications, which is why it is now FDA approved and hopefully going to be an additional method of helping people in acute pain.
So I'm going to ask the question that people are thinking, which is, does it work? Does it work as well? You know what I mean?
Yeah. Well, there were two phase 3 clinical trials where they gave patients this medication, compared it to other patients who were using opiate medications, and they found that the reduction in pain was similar to that of patients who got opiate medications, and more than 80% reported either good or very good response to this medication. There are some issues, however. In terms of long-term benefits, we don't yet know. In the studies, when it went past 12 months, or 12 weeks, excuse me, it found that it didn't reap those great benefits that we saw in the acute period, and the majority of Americans who are dealing with pain are dealing with chronic pain. But again, it's still another possible tool for those in acute issues.
All right, Doc, thank you very much. We appreciate it.